More than 1,100 Valley residents have tested positive for COVID-19 since March, some ending up in Valley hospitals and medical facilities. We are chatting with Daniel Ricones with South Texas Health Systems. Daniel, thank you for joining us.
Thank you for having me.
Daniel, the first known COVID-19 case was discovered in the Valley 2 months ago. What have medical professionals here locally learned since then, and how has it affected care for people with chronic conditions like diabetes?
So one of the first things that we learned was the importance of identifying your symptoms early. Therefore, we could segment population that was positive for COVID-19. So that was one of the first things that we learned. And in regards to how it affects our population with diabetes, they are falling in the at-risk category. So individuals with various conditions, diabetes being one of them, are considered a high-risk population. Now, it's important to note that high risk does not necessarily mean they're at a higher risk of getting COVID-19. They're just at a higher risk of a possible worse outcome if they were to receive COVID-19. That being said, diabetic patients typically have a percentage chance of being obese or have hypertension, and that would put them into the comorbidities that would potentially add to their ineffectiveness in battling the COVID-19 virus.
And Daniel, we were talking about symptoms. Allergies are big right now this time of year for a lot of people. So how can people tell the difference of symptoms? How can they know when they should and shouldn't see a doctor?
So it's most important to just be understanding of what the actual symptoms are for COVID-19. So cough, fever, chills, muscle pain, shortness of breath, sore throat, loss of taste or smell. And as you mentioned, those are common with allergies as well. So one of the first things to make note of is to reach out to your healthcare provider. And with that conversation, they'll better direct you as to whether you are just having allergy symptoms or if you do need to seek medical care.
And we have seen videos and photos of large crowds over at the island. It's Memorial Day weekend. We've also seen large crowds outside of shopping centers as more stores are opening. Are we more prepared now than we were 2 months ago when the first infection was here?
I do believe so. Again, the outbreak in the United States did not start in our local area, so we got a bit of a head start, if that makes sense, in terms of planning. I can tell you here locally at our facility and our campuses at South Texas Health System, as soon as we heard that the outbreak had made it to the United States, we started our planning phase in preparation for handling individuals with the COVID-19 virus. And now that we have the ability to rapid test, along with several partnerships with various labs throughout the United States, we are better prepared to test those individuals that do show symptoms. That, coupled with our plan and our ability to cohort patients, I do believe makes us significantly better prepared to take on this disease.
And Dan, at the beginning of this health crisis, elective procedures were put on hold to avoid overwhelming the hospital systems. Did that result in a decline in revenue for the hospital system? And I hate to ask, but it is, something that other places around the country are seeing. Are furloughs and layoffs a possibility at this point?
Yeah, so to answer your first question, all hospitals rely on surgeries. And though shutting down our surgeries, our elective surgeries for a short period of time did have an effect on our facility, we are proud to report that given the safeguards that we've put in place and given the lift that the governor has recently put in place regarding elective procedures, that our patients are coming back to us. We're very near our pre-COVID-19 surgical shutdown volume and numbers in terms of surgery cases that we're performing here at the facility. So I do feel that here in the Valley, our patients are very well educated. They're listening to what's going on, and they've come back to us. So though there was a minor blip, we feel we're going to come out of this very strong. And to answer your second question, again, as part of the planning, we were better prepared to handle the potential dip in volume. And we're proud to report that at this time, we have had 0 layoffs with South Texas Health System.
Daniel, very quickly, one last question. Your thoughts on what needs to be done with nursing home residents, hospital policies. How do we prevent outbreaks like what we're seeing in Cameron County?
Again, it's being very mindful of those symptoms. And again, I don't say that for an overreaction. I say that to just reach out to your medical provider. If individuals are in a nursing home and they're feeling ill, reach out to those providers. If you know a loved one that has a sign or symptom, just take that step and reach out to somebody that is a professional in the industry, either your physician, a nurse practitioner, physician assistant. And in regards to the patients in the nursing homes, we need to diagnose those quickly and be able to segment them from the remainder of the population. And I believe that would be highly effective in terms of protecting those individuals in the nursing homes.
Daniel Ricones with STHS McAllen, thank you.
Thank you very much.